What's the most heartbreaking secret you've ever uncovered in a hospital? I was in my 3rd year as a maternity nurse when I met Emily. She was 29, newly married, and 8 months pregnant with her first child. She'd been in and out of the hospital for weeks with complications, severe abdominal pain, unexplained bleeding, but every time she came in, the attending doctor brushed it off as normal late pregnancy discomfort. That Monday morning, Emily arrived looking pale, clutching her stomach, tears streaming down her face. "I think I'm losing the baby," she whispered as we rushed her into an exam room. The on-call doctor, Dr. Simmons, barely looked up from his chart. "It's probably nothing. Let's do a quick check." His dismissive tone made my skin crawl, but when I hooked her up to the fetal monitor, my heart sank. There was no heartbeat. Emily sobbed uncontrollably, clinging to my hand. "Please check again, please." I wanted to, but protocol was clear. We called for an ultrasound to confirm. The radiologist's face said it all before he even spoke. "I'm sorry, there's no cardiac activity." Emily collapsed into her husband's arms. Dr. Simmons mumbled something about nature taking its course and walked out like he'd just finished a routine checkup. I'd never felt such rage toward a colleague, but something didn't add up. Emily's medical history showed repeated visits for bleeding and pain, yet no additional tests had been ordered. No follow-up ultrasounds. I remembered seeing her chart flagged for RH incompatibility, a condition that, if untreated, can cause the mother's immune system to attack the baby's blood cells. When I asked Emily if she'd ever been given the necessary RH immunoglobulin shots, she looked confused. "What shots?" My stomach dropped. This wasn't just bad luck, this was negligence. After the delivery, a stillborn little boy with a head of dark hair, I stayed with Emily and her husband while they said goodbye. She asked me quietly, could this have been prevented? I couldn't bring myself to lie. That night, I pulled her entire medical record. The truth made me sick. At her 12-week appointment, blood work confirmed she was RH negative. The standard protocol was crystal clear. Administer the first shot at 28 weeks, the second within 72 hours after delivery. Dr. Simmons never ordered it. Worse, I found a note from a nurse in her first trimester visit recommending extra monitoring due to her bleeding episodes. That recommendation was ignored. Emily's baby didn't die from nature taking its course. He died because his own mother's antibodies destroyed his red blood cells, something that could have been completely prevented with a $100 injection. I filed a formal incident report. The hospital's risk management called me in and tried to spin it. These cases are complicated. There's no proof the lack of medication caused the loss. But I knew the truth. And so did Emily when I carefully explained what I'd found. She broke down again, not just from grief, but from betrayal. With her permission, I connected her with a malpractice attorney. The investigation unearthed other patients who had suffered under Dr. Simmons' minimal intervention philosophy. One had lost twins. Another delivered a baby with severe anemia that required multiple transfusions. 6 months later, Dr. Simmons' license was suspended. The hospital quietly settled multiple lawsuits, but no apology ever came. Emily and her husband eventually had another child, a healthy little girl under the care of a different doctor who followed every protocol to the letter. But she still visits the small headstone in the infant section of the cemetery every month. She still calls her son by the name they chose before he was born. And every time I see her, I'm reminded that sometimes the worst thing a doctor can do isn't making a mistake. It's refusing to care enough to prevent one.